Hello everyone and welcome back to MediInsights. Today we're discussing Avelumab Injection, a targeted immunotherapy used in certain advanced cancers. In the next minute, I'll explain what it's for, how it works, how it's given, possible side effects, and key safety advice you should know, so stay tuned till end. Starting with use of Avelumab Injection. Avelumab, sold under the brand name Bavencio, is used to treat metastatic Merkel cell carcinoma and as maintenance therapy for locally advanced or metastatic urothelial carcinoma that has not progressed after platinum-based chemotherapy, and it is also approved in combination regimens for certain renal cell carcinomas. Next, dosage of Avelumab Injection. The commonly recommended adult dose is 800 mg given as an intravenous infusion over 60 minutes every 2 weeks, and treatment is continued until disease progression or unacceptable toxicity. When given in combination regimens, your oncologist will explain the partner drug dosing and monitoring, and full administration details are provided in the official prescribing information. Next, mechanism of action of Avelumab Injection. Avelumab is a human IgG1 monoclonal antibody that binds programmed death ligand 1, or PD-L1, on tumor cells and immune cells, which blocks PD-L1 from engaging PD-1 and helps restore T-cell-mediated anti-tumor activity. In addition, as an IgG1 antibody, Avelumab can engage immune effector functions that may contribute to tumor cell killing. Next, side effects of Avelumab Injection. Common side effects reported include fatigue, nausea, diarrhea, decreased appetite, and infusion-related reactions. Avelumab can also cause immune-related adverse events such as pneumonitis, hepatitis, colitis, and endocrine problems, which may be serious and require prompt treatment. Infusion reactions occurred in roughly a quarter of patients in clinical experience, so awareness and early reporting of symptoms is important. Next, important advices for using Avelumab Injection. Your care team will usually premedicate you with an antihistamine and acetaminophen before the first 4 infusions to reduce the risk of infusion reactions, and they will monitor you closely with physical exams and blood tests, including liver and thyroid function. Report new symptoms such as severe cough, shortness of breath, severe diarrhea, jaundice, severe fatigue, or unusual weight or temperature changes right away, and always discuss vaccines, pregnancy plans, or other medicines with your oncologist before starting or continuing therapy. Thanks for watching. If this helped you understand Avelumab, leave a question or comment below. Subscribe to MediInsights for drug guides, and let us know which drug you want us to cover next so we can make it soon today.